Hello, Karen. Thank you so much for joining us from over there in Australia. First of all, could you perhaps tell us a little bit about your background, please?
Hi, Dawn. Thanks for having me. I describe myself as a Lyme disease advocate, researcher, and patient, uh, primarily because my background is in research. I was doing my PhD. I'd done a 4-year degree before I got sick and had an APA scholarship, which is basically in Australia. That's a scholarship that's awarded to people that have have huge potential in the academic field. So it's a $100,000 scholarship, tax free, to study. So I was very much into the research. So when I became ill with Lyme and I started looking into the reasons for the denial and why I couldn't get treatment, that was one of my primary objectives, was to write some papers to try and understand why the Australian government denied it, and to try and understand a little bit about Lyme, because it's such it's a big field, and it's so huge to sort of to try and you need to understand why they're denying it. And I looked at all that. So I won't go too far into those. There's some papers that I've written. I've written 2 research papers, and that was just basically a counter argument to the Australian government's paper, which was a study in 1994, which our denial is still based on. So it just goes through and points out a few flaws with both the study and the methodology. So that, and another one which is direction for further research. And it explains Lyme disease in layman's terms, so people looking for a description of this and to try and explain it to their family. So or Lyme borreliosis and the direction for further research. So that's up on my website, and I believe that'll be links at the bottom of what you
Okay.
so.
Thank you. Could we maybe go back to you a bit? And could I ask what happened to you when you became ill, and what the main problems were that you encountered with the medical community in Australia?
For me, it was one of those where I sort of had to have a look and research myself. I was, the first 2.5 years, I developed Bell's palsy, and a trainee doctor kept me on steroids, which set off a lot of health problems and lowered the immune system and made me sicker than necessarily I would have become with this. But I couldn't get help here in Australia. I had an accepting GP that would research it and believed me, because she saw how sick I was. I dropped to 50 kilos, I had tremors, I couldn't get out of bed. But, she also did her own research and realised if she treated me, she could lose her licence or get sanctioned, because there was no Lyme disease in Australia. So while she was very helpful to have, as in that someone believed you, because there's a lot of that, having that disbelief is really tough on top of an illness. She was really good, but eventually my family took out loans and I went overseas to the UK for treatment. I did have brain scans that showed hypoperfusion throughout and red encephalopathy, possibly due to Lyme. And those words have caused an enormous problem for me with other specialists, like neurologists, who prefer to go, they look at that Lyme word and go, how dare they use that? That's not in Australia, rather than look at the fact that, my brain, there was a problem with my brain, and would prefer to say I was depressed or that I was making it up, or, I just wanted to check out of life, rather than, going, well, what's happening here? So that's a very tough, when you know that you've worked your whole life to sort of achieve, and then you're told that you're faking it or you're doing stuff. So if I had the upsetting thing for me is, if I had have got treatment on my first brain scans, I wouldn't have the damage to the acquired dystonia, which is damage to the basal ganglia. So this is kind of why, like, fighting for awareness, and at the acute stage, as you know, awareness, the acute stage, it's 4 to 6 weeks worth of antibiotics, and you're basically good to go, so to speak. So just don't want to see in my, when I got back from the UK from treatment, I still had a lot of damage, so couldn't go out. I can't have a lot of sensory input.
Was it there in the UK that you were diagnosed and not in Australia?
No, sorry for that. I was trying to say I'd lost you. I couldn't hear you.
That's fine. Sorry.
No, there was one lab here that was doing testing. So I had I tested PCR positive. When I started tracking back my symptoms, I actually realised that The rash that the doctors had described as a rare fungal infection was an EM rash that my younger daughter had. She's tested PCR positive, so we had all the positives to the infections before we came over to the UK. So that was good to send them over and to treat, because they're, you know, the UK, as you know, is still limited in what they can do, but they still need the positives so that they're not sanctioned by doctors as well. So, but this is, for me, having my experience and having my children also get sick is one reason I want to do the advocacy. I started the support groups, and we run one of the biggest ones in Australia with a support team. There's an admin team of 7 of us, and there's so many children in there that are, you know, in pacemakers, wheelchairs, and they're losing their childhood. I was 39 when I was sick, and you know, we're trying to just stop this happening to any others. So that's why advocacy is so important for me, and why I do a lot of it. And having the sensory input issues is why I do a lot of work online. I can't really socialise. I can't listen to music still. Can't have too much sensory input because it just sends my brain sort of into overload. And that's, to get awareness, we kind of decided with campaigns and everything. I learned a lot from the Americans when I first started learning about Lyme disease.
Could you tell us a little bit about the different campaigns that you're running, please?
Yep. We started out, first of all, the Worldwide Lyme Protest, which I joined Australia up for back in 2013, was the basis of sort of meeting all the international advocates and meeting all those and connecting with all of those. And there was one, you know, American lady in particular, Lisa Hilton. Her and I got together and we did a website to actually connect all the other countries. So we put all their information up. So that had us working together. And we developed an association, Global Lyme and Invisible Illness. So with that, we put all the different countries on there. And when an Australian lady theatre, my aunt, took her life in July 2013, I'd said to Lisa that I wanted to. She was an ME/CFS diagnosis, then a Lyme patient diagnosis, so she was well known within the online community, and to bring that invisible illness sort of together to show that it doesn't matter whether it's Lyme or whether it's this or whether it's that. There's so many people in their houses that are being ignored. Our medical system is kind of broken, and we need to all unite and get this out there. So we had Red Shoe Day, which is July 25th each year. Our first Red Shoe Day was 2014, the year after theatre passed, and you know, I connect with the parents. I connect with the parents of all those that we've lost. Sadly, those that take their life are generally those that have gone to a doctor and been told it's all in your head.
So,
you know,
sorry, what was that? Someone in Australia who did
theatre? Yes, theatre
yeah.
was 40. Again, on my website, I have a Forever Remembered, and I have the Red Shoe Day. So, you know, if you look at these, you know, theatre she'd had a journalist background, an art background. She'd done a lot of degrees at university, had scholarships to, you know, to start on these programs, and she was a budding journalist, and then got sick, and for 14 years she was bedbound, and her 70-year-old mum was a carer. So what finally for her was, they said they couldn't do anything. So it's like, well, you know, until you treat your Lyme, we can't get rid of your pain. So hospital wasn't an option for her because they'd tied her down at one visit. You know, migraines, they'd tied her down in the psych ward. So she would prefer, and this is where we're saying to our government, who now in Australia, they want to put psychiatrists at the lead of our multidisciplinary teams. And it's like, well, you can't, you're actually, you know, you're going to cause it's not, you can't say that an infectious disease is going to be fixed with CBT therapy. You know, that you've got to look at the bigger picture. So currently at the moment, yesterday we had a meeting with the Department of Health in Australia has set up a clinical pathways trial. So we had our first meeting, walking that forward. You know, we sort of went in there with a little bit of hesitation. We're not really sure how that's going to go, but we're sort of, we had a Senate inquiry in Australia. That Senate inquiry decided that there needed to be something done. So the Department of Health is doing something. But then we have this Department of Health, the AMA, or the Australian Medical Association, is basically arcing up and saying, well, the Department of Health, the government can't tell us what to do. So they're saying that, you know, they're putting it up to to their doctors, you can't treat Lyme disease in Australia.
Oh.
You can't diagnose it. So it's kind of like the patients are stuck in between this political battle. So for us in the advocacy, our direction at this particular point in time, especially with the Red Shoe Day with Theatres Foundations, is to raise money and we've done the science, we've done the awareness. We just want to keep raising awareness. Now the aim for us is to raise money and buy some land, by 100 acres out in the country, and start putting little single apartments there, because currently we look at like losing more doctors. We're not really, and while we're waiting for, there's other associations in Australia. There's the Comet Manus, which is doing science, the Lyme Disease Association, which is sort of, they're doing the government. So we're stepping back and just looking after the patients and trying to get this assistance.
That's superb. Thank you. That's absolutely fascinating, and we'll all look into that a lot more. And we have a link to your website up on the screen now. So thank you so much, and look forward to maybe seeing you here in the UK soon. Thank you.
I hope to be back.
Thank you.